caused from, you've had dengue fever before, you've developed antibodies against that virus, and then you get exposed to it again, and the antibodies that you have built up against it combine with the virus. So it can induce shock in a victim, which is usually a child, and kill them within a few hours. And it is one of the leading causes of death among Southeast Asian children. Now this one's a emerging virus called hantavirus. Affects the lungs. And I remember when this one was being worked on and they discovered this virus in 1993. They called the virus Sinombre, without a name. It's a Bunya virus, and it's found mainly in the western states. The first case was a woman, and she died from it. She was in a cabin, and they surmised that she got it by sweeping her porch off, and the virus is in the droppings from rodents, and then they become airborne, and she inhaled them. So transmission is by inhalation of airborne viruses from dry urine or feces of infected rodents. And it causes a frequently fatal pulmonary infection where the lungs fill up with fluid. Diagnosis is by serology, detecting IgM antibody. Ig is an antibody to the hantavirus in the patient's blood, or doing PCR technique, checking for hantavirus genetic material and clinical specimens. Prevention are to avoid mouse habitats and droppings, which is impossible, of course. And every year they have some outbreaks of this virus, a lot of times in the Yosemite that's in California. Yeah, Yosemite. Treatment is supportive, meaning mechanical respiration. And there's a rapid onset and a high mortality rate with this hemorrhagic virus. So that one has only been around, seems like a long time to you probably, 1997? almost 20 years. Also being an emerging virus is Ebola, caused by a filovirus. That's a thread-like, I have a picture to show you, thread-like RNA virus, and it's endemic to Africa. The natural reservoir host, they don't really know, but you know what the reservoir is, but they're thinking now it might be this cave-dwelling fruit bat, and it carries the virus, but it doesn't get sick from it. It's not affected by the virus, but it's carrying the virus. Once a human is infected, then person-to-person transmission can lead to large numbers of affected people through contact with blood and body fluids. And then in Africa, another way they could spread it is needle reuse. I don't know, you don't know, but they used to put about, from what I heard, 10 people to one needle. So they used the needle, and well, I have to tell you the story. When I worked in Egypt, I got really sick, and we stayed in a hotel, you know, at the Samira Maze. And the girl I worked with called the nurse or whoever it was there and sent her to my room. I was really sick. And she came in and shot me with a needle of something. I didn't even know what it was. And she threw the needle in my trash in the room. I guess to show me that she didn't use the needle again. But you want to bet that maybe they don't take those needles out of the trash and reuse those?
Yep.
Yeah. I was pretty freaked out about it. Also over in Africa, they have a custom, you know, when somebody dies, is that the relatives wash the body. And this virus is in all that blood and stuff that is on the body. So that's another way that the body gets, the virus gets spread. So early symptoms are non-specific to Ebola, and they can be seen in other diseases such as malaria and typhoid fever. Air travel has contributed to the spread of the virus to the U.S. I was pretty freaked when we had cases over here. I just wouldn't want Ebola running through the population. Later symptoms are more severe, and they include nausea, vomiting, bloody diarrhea, a rash, chest pain, cough, stomach pain, weight loss. That virus has a virulence factor by causing disruption of clotting factors. So that results in massive hemorrhages. So and all this hemorrhaging has the virus in it, the blood has the virus in it. And it's from all body orifices, mucous membranes, internal organs, just a lot of bleeding.
Right now it is contained in Africa.
It's always in Africa at a certain level. That I think you don't hear about it now, but there's still Ebola cases going on over there. Yeah.
Because there are some areas that they don't let you visit.
Go there?
Yeah.
Mm-hmm. Yeah. So a lot of people have died over the years. It's been around for quite a few years over there. Diagnosis is through PCR, ELISA, which is a test, or viral culture that is conducted at the CDC. Because they grow this virus up on, so check for it. That's a picture of the virus, the filovirus, which looks like a big long thread. Burkitt's lymphoma. That's a fast-growing tumor of the jaw, see it in African children. The pathogen is Epstein-Barr virus. What else does that Epstein-Barr virus cause? One common here, or it used to be common. Mononucleosis. Ever heard of that?
Mm-hmm.
The official name is human herpes virus 4. It's associated with children who have had malaria, and then that impairs their immune response to the Epstein-Barr virus. And Burkitt's lymphoma is rare in the United States. So there's a picture of a little boy, and I think your book has a different child that has this.
We've seen him before, isn't it?
Hmm?
We've seen him before, isn't it?
Yeah, I showed you that. I showed you that picture before. Yeah, and the tumor is just distorting his face. Okay, let's take a like a 15-minute break, and then we'll come back.